Hello everyone. Welcome back to the Medical Microbiology practical. This is Jihan University Toho, College of Pharmacy, Medical Microbiology Practical Lecture 2. I'm Dr. Marwan Hussein, and I'm going to present the serological test for the detection of viruses. So if you remember that, just to remind you, the first semester we have the structure of viruses, and the how it infect or attach to the target cell of the viruses in general, and then how it is infect the target cell, of course, and how they clone, or the reproducing or reproduction, or cloning, if we can say that, the itself inside the target or the host cell. So in the practical, just I'm going to show you that the rapid test, according to the serological test, detection of the hepatitis viruses and HIV virus. So hepatitis, at first, it is an inflammation of the liver, the most commonly caused by viruses. And the symptoms, this is some of symptoms: fatigue and nausea and abdominal pain, and then itching sometimes, and joint ashes, of course. Serologic, the viral hepatitis, the most common liver disease in the world. We have 6 types of hepatitis: hepatitis A and B and C and D and E and G. Hepatitis A, known as infection hepatitis, caused by B coronavirus and spread by the fecal-oral route. So the incubation period here is around 1 month. Hepatitis B, previously known as serum hepatitis. Hepatitis B, HBV, it is a member of HEPA DNA virus with DNA genome and spread parenterally by blood or needles, or even by sexual contact. The incubation period here is around 3 months. Hepatitis C is called sometimes non-A and non-B virus. It is flavivirus with RNA genome and spread by the same as HBV. So usually causes chronic liver disease. GV, hepatitis G, it is like the HCV in many ways. Flavivirus, and transmitted in blood, and has a tendency for chronic hepatitis disease. For detection, of course, we will use the rapid test, a strep or cassette procedure test. This test is designed for the detection of hepatitis specific antibodies, IgM and IgG, in human blood or serum, or even in plasma. So it commonly used as the screening tool to detect acute or recent infection, which IgM. So IgM is sign as or give the signal of acute or recent infection, and the IgG give the past infection, and the result appear within 15 to 20 minutes. So sometimes we're going to do combining between IgG and IgM. So combined test, similar to as we explained in the last slide. So distinct lines for IgG and IgM, so to differentiate between acute and past. So IgM, it is recent infection, and IgG, it is a past infection. In the rapid test, the principle is as I said, it is rapid test, the antibodies and antigen. So uses the lateral flow technology with specific antibody markers. We have buffer, and this buffer contains the antibodies. Antibodies, yeah, and the membrane is the in IgM pre-coated with anti-human IgM in the test line region, which is T is test. This is the strip. This is a type of strip, and we have another type, of course. In this type, we have two lines. Band. This is C and T. C is control, and T is test. T for sample. Here we're going to add the drop of the sample, and then drop of buffer. It is provided with the strip, of course. When you put here the drop of serum, and then drop of buffer, and waiting for 15 minutes, it will appear here two bands like this. Look, if it is two bands, it is positive. One band is in C, it is negative, and if it is just in T, just in T, not in C, that means it's there is wrong in the test, and we have to repeat it. You have to repeat this. So this is the buffer, and this is another type of rapid test. The another test to do detection today, it's HIV, human immunodeficiency virus. The same principle, of course, and then the HIV cause it is human immunodeficiency viruses, and cause the AIDS, AI, acquired immunodeficiency syndrome, and it's a dangerous infection, and spread around the world, move them above years around in the prevalence in the world. And until now we cannot find the no vaccine here, and the drugs or medicine just delay or may decrease the symptoms, but no treatment, completely treatment for this. The procedure here, it is rapid test, a strep test. The kit contains all of this, all of the things we needed. We will open, and then just to clean the finger, to have a sample blood from the finger. Clean the finger with alcohol, and then prick with a lancet and wipe away. So the first drop of the blood, we're going from the finger, we're going to put the drop of blood on the place of the sample, and then add the buffer, 2 drop of the buffer, and then waiting for 15 to 20 minutes, of course. As I said, it is a rapid test. So here we can detect the HIV-1 and HIV-2, of course. HIV-1, and this is like antibodies, of course, and antigens, strains maybe of the HIV, of course. So as I said, the positive let me show you here. The positive, there's two colored bands appear, one in C, control, and the other in T. A positive reserve indicates, as I said, indicates the HIV-1 and HIV-2 or HIV-2. Negative, only one colored, which is C, it is control. And if it is just in the T without a C band, it is invalid. We have to repeat this. The other way to do the detection, it is latex agglutination. Again, it is kit and a strip. So for check the certain antibodies or antigens in a variety of body fluids, saliva and urine and CSF, spinal fluid, and blood, of course. The simple rapid latex, it is LAT, rapid latex agglutination test, developed to detect in the rabies virus, of course, rabies virus, RABV, and in antigen in saliva and saliva. Latex particles are coated with anti-rabies antibodies, and then when it is mixed or combined with the sample, it will give positive or negative, of course. The principle here uses a lateral flow chromatographic immunoassay, so determine, as I said, in the HIV-1 and HIV-2, or like similar strep test, and the result will appear, of course, again in between 15 to 60 minutes. Between 15 to 60 minutes. This is the shape of the strep test. Look, this is positive, and this is invalid. Just it is negative, and this is, of course, before you do the test. This is the positive, and this is the negative. Another type of strip like this. This is the two band. Look, it is the same principle. HIV-1 or HIV-2, and of course control. Thank you for your listening. This is our lecture